Thank you, Deputy Speaker. And I rise tonight to talk about health in the electorate of Lalor. And I have spoken about the needs of our local community in terms of health, and particularly in terms of the Werribee Mercy Hospital, on several occasions in this place since joining my colleagues. And all of the times I've risen to speak about the needs of our community in terms of our local hospital, I have been highlighting the needs and the growing demand. I've highlighted that the Mercy Hospital was established to serve a population of around 80,000, and now we live in a community of over 200,000, and that the hospital needs an upgrade desperately to serve this community. It's with absolute pleasure tonight that I rise to celebrate the fact that federal Labor have a history of supporting Werribee Mercy Hospital in the contribution, the most recent, of $30 million to build the Macaulay Centre, which services the community in subacute beds and has had an enormous impact on the health of subacute patients and resulted in a reduction of the number of patients returning to hospital after they leave the Macaulay Centre. But we've had very good news of late, Deputy Speaker, very good news indeed, because the Andrews Labor government in Victoria have announced in their budget that there will be $85 million spent in forward estimates to do an extension to the Werribee Mercy Hospital. This is being celebrated, Deputy Speaker, in my community because of what it means on the ground. It will add 6 additional operating theatres, 64 inpatient beds, including, most critically, 8 beds for a critical care unit. As members of the House will understand, a small country hospital is what has been servicing my community, and with this injection of funds, the strategic plan will be implemented in full, and we will have ourselves a hospital that will service our community. No longer will ambulance bypass the Werribee Mercy Hospital with critical care patients. No longer will patients in hospital for one thing, as already in the hospital, have a critical incident, have to be removed to emergency department where they can be monitored for critical care. Those 8 critical beds will will fill absolute need in the hospital, will allow our operating theatres and the new operating theatres to ensure that our local hospital serves our entire community, Deputy Speaker. And it's a celebration, Deputy Speaker, because it demonstrates that when it comes to health, Labor, both federal and state, are prepared to work for the West, are prepared to invest in the west of Melbourne, are prepared to take seriously the health needs of our communities. And this is such good news, Deputy Speaker, in light of the $50 billion worth of cuts that this federal government has put into the next 10 years across this country. And it is important that in light of that, our state government has made this commitment to my community and to all of those in the West who will be impacted. It is a really important point to make that if the Mercy Hospital is servicing the needs more generally locally, then those hospitals nearest to us, those 25 kilometres away, will have less demand put on them. So it is with absolute pleasure, Deputy Speaker, that I rise tonight to celebrate the funding for the Mercy Hospital. I'd like to acknowledge Steve Cornelison and Lyndall Mallows of Mercy Health, who have been incredibly strong advocates for the hospital, and they've also been flexible in responding to community need and to community demand. I'd also like to congratulate Jill Hennessy, Minister for Health in the Victorian State Government. Jill has been very aware of the situation, being a member for Altona and being close to our community. And of course, local member for Werribee, Tim Pallas, the State Treasurer of the Labor government. Terrific decisions made by state Labor.